At 10 a.m. on Thursday, the 18th of September, an explosion marked the start of exercise Joint Endeavour. The culmination of a 2-year programme by the Joint Emergency Services Interoperability Programme. The purpose of Joint Endeavour was to test the ability of the emergency services to work together at all levels, from the responder to commanders at operational, tactical and strategic level, following JESIP's doctrine and key principles. Co-locate with commanders as soon as practicably possible at a single, safe and easily identified location near to the scene. Communicate clearly using plain English. Coordinate by agreeing the lead service. Identify priorities, resources and capabilities for an effective response, including the timing of further meetings. Jointly understand risk by sharing information about the likelihood and potential impact of threats and hazards to agree potential control measures. Shared situational awareness established by using methane and the joint decision model.
Remind ourselves.
JESIP has been the most extensive, ambitious and successful joint training programme ever undertaken by the emergency services. Over 20,000 staff have been trained. The aims and objectives of Joint Endeavour were to test the co-location of commanders, the sharing of information and a common situational awareness, the effective coordination of emergency services staff, including the management of risk. Uniquely, this exercise also tested the response from the victim's perspective. The exercise, involving 45 agencies, took place in and around the Fire Service Training and Development Centre in Merseyside. There were 850 participants, 150 of them were casualties. Strategic and tactical coordinating groups were formed as the incident developed. Observers, including the media, viewed events from the roof of a building. Among those watching was the Health Minister, Earl Howe.
This is the culmination of JESIP today, but there will be continual learning that follows on from that. And JESIP in itself has produced some very valuable training materials, both hard copy and e-learning materials, and joint protocols that will stand the emergency services, I believe, in very good stead going forward.
The scale and nature of the incident meant the initial response was carried out under intense pressure, as it would be for real. Casualties had to be located and triaged at a number of challenging environments. A methane report was provided from the incident ground by a commander to their control room. Methane ensures that what was known about the incident was clearly communicated and shared in a commonly understood manner. A number of specialist resources were deployed to assist with the incident, including military air assets and urban search and rescue teams. Casualties were rescued from difficult-to-reach locations by multi-agency teams working together in a coordinated response. A traumatically injured woman was found in the collapsed flats. She was treated on scene with an emergency amputation and then evacuated.
In terms of the number of fatalities and casualties.
During the afternoon, press conferences were held at Joint Command and Control. The use of a mock news website and social media feed meant the capabilities of the emergency services press officers were also tested. After the exercise, there was a series of comprehensive debriefs. To ensure the lessons identified become lessons learnt, leading to improvements in interoperability, their progress will be monitored through the joint organisational learning arrangements. The emergency services must continue to ensure that local policies and procedures are aligned to JESIP. The training products are incorporated into learning and development programs, staff are trained regularly, and are supported in attending multi-agency exercises. The use of JESIP principles, methane, JDM, are essential in achieving the ultimate goal: working together saving lives.